We don't have too many questions, and we are already over time. I was wondering if you've been involved in any discussions, I guess, going back to the industry, because I think of the really big clusters being in the industrial settings where people are congregated and just bigger workforces in one place at one time. Although maybe I just don't understand how many people are in the grocery store. But just wondering about the ventilation and controls, whether there's been like any discussion about improving those kinds of things and monitoring carbon dioxide levels, any of the sort of solutions that we're looking for that we think might actually make a difference in workplaces like that.
Yeah, thanks for the question. I mean, a lot of those workplace settings have already had a lot of effort placed on health and safety features around ventilation and things, and are particularly if you're talking about a facility that processes live animals,
Mhm.
what they now call in a sort of PC fashion, the harvesting animals. Uh, there has been significant effort placed on making those conditions as safe as possible, providing proper ventilation for the workers in those facilities, making sure that they have access to face ventilators as well. And so a lot of our members had had access to N95 masks prior to the pandemic in
Mhm.
those settings. It was certainly then a challenge when everybody wanted access to N95s, as quite rightly people want to be as safe as possible. And so there were very big supply constraints at the beginning of the pandemic last year. But we have made considerable efforts around that already. We have spent a lot of time talking to the various meat employers and industrial food employers about the construct of the plants as well, and how people are close together and whether the lines could be reduced in speed and spaced people out. Those continue to be ongoing conversations. And
Mhm.
we're trying to have them with some of the employers who are in the process of creating new facilities, that it strikes us that now's an opportunity to maybe look at the model
Mhm.
and try to future proof it a little bit, because as much as I would like to say that we'll never see another pandemic again, history hasn't been kind with respect to that. And I think you never know. And so we should learn lessons from these things, and we should apply them as much as we can to keep everybody as safe as possible go forward.
Yeah, it's good thinking for sure. So there's I guess some questions, a question here for Mario in terms of wondering what effects your reports have had, and or has there been feedback from any levels of government related to any of them, or any next steps in that regard?
No, no. Sadly, like the efforts that Tim and Natalie and everyone you know, have done. Um, there's been little positive feedback, and it's been so disappointing because one of the things I want to highlight is the work that John Udick has done, from your shop, Valerie.
Hmm.
John has made some of the finest analysis that I've seen in COVID-19. And one of the things that I was able to do, thanks to John, was I actually published a large paper that he presented to science tables in the spring of last year. Very well argued, very well articulated, very well documented. And I want to put it out there to show people the level of information that the Public Health Agency of Canada and Ontario were getting and we're ignoring. And it's just, when you go and read what John presented, you wonder, how can these people not be persuaded to take a precautionary approach? Thank you.
Yeah, I'll just paste in a page that includes a lot of those analysis that you're referring to that John did last spring and fall. Thanks, Mario. So then there's another question about, and I think I don't know if anyone has the answer. Do we know what coordination there has been between the WSIB, MOL, MOH, and PHO in terms of information gathering and information sharing of workplace exposures? I think that's actually the point. They're not telling any of us, but maybe, I don't know if anyone on the call, any of the speakers, or have any idea of any coordination of counting or accounting for worker cases and illnesses and deaths too, actually. Anybody have any thoughts on that aside from frustration?
I can't speak specifically to coordination between the MOL and the WSIA, et cetera. I mean, I can tell you that part of my role with Local 175 and 633 is to try to do our government relations. And it has been a frustrating experience for me in that it doesn't seem like many of the ministries are really talking to each other. And
Mhm.
this is something that not only do I perceive when I talk to them, but I hear complaints back from various people in various ministries as well that Ministry of Labor doesn't get to talk to health on a regular basis. The Ministry of Long-Term Care doesn't get to talk to health or labor on a regular basis. And so my overall takeaway is that the coordination between the various ministries and various agencies of the government is poor.
Mhm. It's interesting. I've heard people just from the Ministry of Labor describe unprecedented collaboration in on the migrant farm worker world. And it is, I guess, unprecedented in terms of in the past, there were complete silos between the federal government, the Ministry of Labor, the Ministry of Agriculture, Food and Rural Affairs, and the Ministry of Health and Public Health, and then the local public health unit. So there is a bit more now, but it's still, in our experience, it's something that Tracy described in the deferring, always deferring to another jurisdiction as being the one who should be doing something here, and then so much falling through the cracks in the process. So, Tracy, did you have anything you want to add about any coordination between ministries or not?
No, it is definitely a problem that needs to get fixed, and it's a shame because it was noted in the SARS Commission about fixing those communication problems and making sure they work together to take responsibility for everybody's safety. So hopefully we can push forward so that this doesn't happen again.
Mm-hmm.
And I think that may just mean electing a new government, because I don't think this government will actually do a proper debrief of this.
Yeah, that will be interesting to see in terms of whether there's a SARS commission again, or and what, I mean, it would have to be a much more investigation required, I think, Mario, don't you? Compared to the numbers that you were dealing with in the 2003, the number of cases, the number of people impacted, this is magnitudes of order bigger.
Oh, absolutely. We only had a few hundred cases here in Ontario, but that offered I think a great blueprint and recommendations that had the province and the country, in fact, followed and taken up Justice Campbell's recommendations and followed his wisdom, we'd be in a much better place. I think one of the things that I hope that all of us here on this call think about is, what should a national commission or an inquiry look like? I know Alec Farquhar has spent some time looking at this, but I think it's important for us, people in labor movement, in the worker safety community, to begin putting forward ideas in the public. How should this go? Who should be on it? Because you look at the Morocco inquiry, which is going to come out in a few days. I mean, Justice Morocco is terrific, but gosh, they've hamstruck that committee. They delivered hundreds of thousands of documents late, and they didn't allow the inquiry to go beyond the very, very tight April 30th deadline. So I think it's incumbent on us to really put pressure to really make sure that there is a good inquiry, but that is done properly.
Yes, I think that's true. We'll have to do another Occ-COVID session, I think, on what that could look like and what's happening around the world. We know there is some kind of a people's, not a people's court, but initiative in the UK. And I was interested to see a number of researchers on an international call on a Saturday morning a couple of weeks ago, which was the Zero COVID Day, I guess, where the researchers were advocating across the world for people to read the SARS Commission and to follow that in its not in its structure, but already there's a number, as you've pointed out to us, a number of solutions in terms of the precautionary principle and in terms of listening to the workers and engaging multi disciplines and in balancing between occupational health and public health. so many things that are still relevant today, and sadly not currently being followed. So I think Ontario and that work is foundational, I think, and we still have the ability to influence things in a broader way, I think, for the country and beyond, if we keep dialoguing about it and finding solutions. So
Valerie, if I can just add one more thing. I know that we're getting towards the end, but I just want to urge everyone on the call, if they haven't done so already, to look at the terrific letter that Kevin Hedges of OCAL coordinated with respect, voicing significant criticism about Mark Loeb's study at McMaster. I think Kevin and his team, which includes people like Lydia Mrowska, I mean, are really some of the really top people in the field. The questions that they've raised, and the recognition that's been received in the media with the Toronto Star article, vital that this work has been done. And so I urge everyone to look at that. It's a great letter. When I sent it to Don Milton, he just was over the moon with the quality of the analysis.
I don't know if Dorothy, if you're still on, it is posted on your website, I think, right? You could put it in. Yeah, it was, and that study, for people who don't know, it's around a study that's being done offering masks and respirators as an equal opportunity to nurses and other healthcare workers, I think, as though they were, and in fact, trying to prove that there's no difference in protection, and that the actual the result they're testing is COVID diagnoses, which is just, using that as well. We'll let people get sick and see how many of them get sick. Literally, it's a canary study, and it's. But anyways, it gets into the complicated world of research ethics and consents and things like that. But thanks for raising that, Mario. So yeah, we are over time. I don't see, and Dorothy has posted to her COVID page, which includes the letter and some recent worldwide media coverage around the airborne issue. So we do invite people to go there. And I don't see any other questions, so I think I will say thanks and wrap it up. You see that that Vani posted the link for the evaluation, but for some reason it didn't go in as a hot link. Sometimes that's a problem with this program now. It depends on where you get your link from, whether it appears as a link. So, but please paste it in your browser and evaluate so that we can learn and some ideas for other topics. Right now, we don't have another Occ-COVID scheduled, but I imagine we will run one in May or definitely in June. We have the session that I have pasted in on the day of mourning. We are doing a session around international agricultural workers. As Tim had mentioned, there's been a significant impact on them, including 3 deaths last spring of workers from Mexico. But once again, wanting to mourn them and name and hear about them, but also what can we do about it? And then our Mayday Workplace Mental Health series starts next Friday, and the first session is around the pandemic experience, which includes the healthcare data, the data from the education sector, which is significant numbers that hasn't been presented before, and then the more general as well. And then the series includes 2 weeks that are curated and hosted by the Copenhagen Psychosocial Questionnaire Group, the COPSOC network, and that will be very interesting with international content. And then content on the 14th from workplaces that OCAL has worked with, particularly in partnership with Terry Szymanski from OPSU. And then the last week, which includes CAMH doing a presentation about a lot of their recent work on violence and other mental health, workplace mental health solutions they found jointly there. And then the last one is about partners and new content from OCAL, but also from some of our partners. So I hope to see you all there, and we'll be back in touch with more COVID prevention content as we can organize it. So thanks to the speakers today. We really appreciate it. And thanks to everyone who joined us. Okay, have a good weekend and stay healthy and safe as you can.